The healthcare system in the United States is known to be complicated, stressful, and expensive to say the least. So, along came Oscar Health. Oscar Health Insurance leverages technology to help its members have access to a curated network of the best doctors and help consumers navigate the system. They sell plans that are lower cost and higher quality than other offerings. It is interesting to see how exactly are they able to do this. Like I said, Oscar's networks are curated. Using a variety of criteria, Oscar's research and technology team developed an algorithm to identify the best doctors in Oscar's service areas. Based on this, they developed what they call the Network Scorecard, which helps members decide what doctor they should go to. Julian Friedbrown, a researcher at Oscar, said, "Quality of the providers is an important but often challenging factor to define. Our internal definition of quality is just now finding a stable home with our team." We should be wary of what kinds of things are going into the algorithms that determine who the good or right doctors are. Perhaps some of them simply don't have as much of an internet presence and thus are not recognized by the algorithm. Even if it is unintentional, by directing its members to some doctors more than others, Oscar might be harming the business of many practitioners. And this reminded me to the chubby maps case we talked about in class. Particularly because one of the data points it uses to assign quality scores to its providers is based on user-generated feedback. As Oscar expands into new markets, it should, like Chummy Maps, think about what kinds of criteria they are feeding into the algorithm and whether or not they are leaving an important set of doctors outside of the map. They already have a team that evaluates the quality of the network on an ongoing basis, but like we saw with Facebook's curators of trending topics, this does not guarantee that the output will not be skewed towards certain kinds of providers. So I took a look into their privacy policy, where they lay out the kinds of personal health information they store and how they use it. Oscar Health is in the business of providing anonymized personal information and aggregate usage information. However, as we've seen in class, even if data is anonymized, there is still a danger. Through cross-referencing other data sets, 63% of Americans can be uniquely identified by birth date, gender, and zip code. Mobility data is also useful. Through 4 random points, you can uniquely ID mobile traces of 1.5 million users. The company should definitely take this into account because a recent feature in the Oscar app allows them to track your location. It is important that Oscar takes appropriate measures to strengthen the anonymization of their members' data through methods such as suppression, future hashing, generalization, and strategic addition of noise. As an insurance company, Oscar is looking to build its predictive analytic tools. According to Oscar's CEO, the path ahead for the company involves navigating costs by knowing more about their members. The first thing that came to mind when I read this was Uber's Algorithmic Markets. Oscar just released a bot available on Facebook Messenger that tells the users what kinds of prices they would get for the service. It wouldn't be surprising to find out that Oscar is gathering data from Facebook profiles to create an effective price discrimination system. Here I would tell them to be aware of the feedback effect of price discrimination, where the poor may be charged more due to lower elasticity. Another area where Oscar uses predictive analytics is with the health providers by algorithmically generating flags on members who it identifies as most at risk. When we looked at Google's predictions for flu season, we learned that correlations can be misleading because of unrepresentative source data, reliance on proxies, new data different from training data, and overfitting, among other source issues. Because of this, I was surprised to see a blog post where Oscar's research team claimed to have the tools to identify when and who should get flu shots based on previous year trends. There are many ways that Oscar Health can learn to manage its algorithms. One of them is learning to reassess the future selection. For example, in this specific case, there might have been lots of people that had similar symptoms as the flu, but actually different diseases. There are also people who try to game the system, specifically those people who want to promote flu shots. There's also the problem of overfeeding, because people search more for flu as a result of the system. It is important then to check against another algorithm, and check on the effectiveness of the system by cross-checking with other data. Final thing that I would like to discuss is the way that Oscar Health uses machine learning to deal with fraud. They have to be careful that the algorithms they use to determine potential delinquency do not take into account racial data or proxies. As Oscar grows, it will definitely need to set up audit and algorithmic risk management teams in order to deal with compliance and transparency. Oscar is already disrupting healthcare, but the only way it can continue to do so is by establishing itself as a company with ethical data practices.